Hello guys, welcome to our new video. In this video today we are going to discuss about the classification of anticholinergic drug or cholinergic antagonist. In our previous video we already discussed about the cholinergic drug. Now today's discussion is anticholinergic drug, and the effect of this drug are just opposite to that of previous one, that is just opposite to that of cholinergic drug. Now for descriptive purpose, anticholinergic drug are divided into two types: anti-muscarinic drug and anti-nicotinic drug. Anti-muscarinic drug are those drugs which blocks muscarinic receptor, that is muscarinic receptor are M1, M2, M3. These anti-muscarinic drug are these drugs which blocks muscarinic receptor, and anti-nicotinic drug are those drugs which blocks nicotinic receptor, that is NM and NN. And anti-nicotinic drug is further divided into two types: ganglionic blocker and neuromuscular junction blocker. Now in this video today we are going to discuss about the classification of anti-muscarinic drug. Anti-muscarinic drug, according to the source, it is of two types, and one is naturally occurring and another is synthetic and semi-synthetic. Inside naturally occurring, the drugs are atropine and iosine, and inside synthetic and semi-synthetic there is further two types: quaternary compounds and tertiary compounds. Quaternary compounds are those compounds, those drugs which are water soluble but not lipid soluble. So they are not lipid soluble, they don't cross the blood-brain barrier, so central nervous system is absent or less central nervous system effect. So quaternary compound includes isopropamide and propanthalin. Isopropamide and propanthalin. And tertiary compound are lipid soluble, they cross blood-brain barrier, so they have central nervous system effect. And tertiary compound includes tropicamide, homatropine and pyrazapine. Just summarize the classification: naturally occurring and synthetic and semi-synthetic. Inside naturally occurring, there is atropine and iosine. Inside synthetic and semi-synthetic, quaternary compound and tertiary compound. Inside quaternary compounds, isopropamide and propanthalin, and inside tertiary compound, tropicamide, homatropine and pyrazapine. Now another classification of anti-muscarinic drug is according to the clinical use. According to the clinical use, we can divide it into 7 or 8 types. Now according to the clinical use, atropine like mediatics are ophthalmic anti-muscarinic drug. They are homatropine, tropicamide, cyclopentolate and scopolamine. Atropine like mediatics includes homatropine, tropicamide, cyclopentolate and scopolamine. And antispasmodic or spasmolytic. Antispasmodic or spasmolytic includes iosine, ambutylbromide, dicyclomine and propanthalin. Atropine like antiulcerant includes pyrazapine. As a bronchodilator are used in a respiratory disorder, we can use ipratropium bromide and tiotropium. As an anti-muscarinic drug, as an anti-Parkinsonism drug, we use benzotropine, benzoazoles and procyclidine. As an anesthetic premedication, we use glycopyrronium, and as an anti-motion sickness, we use hyoscine and scopolamine. Let's summarize one time. Atropine like mediatics or ophthalmic anti-muscarinic drug, we use homatropine, tropicamide, cyclopentolate and scopolamine. As an antispasmodic or spasmolytic, we use hyoscine, ambutylbromide, dicyclomine and propanthalin. As an atropine like antiulcerant, we use pyrazapine. As a bronchodilator, we use ipratropium bromide and tiotropium. As an anti-Parkinsonism, we use benzotropine, benzoazole and procyclidine. As an anesthetic premedication, we use glycopyrronium. As an anti-motion sickness, we use hyoscine and scopolamine. And this is all for today's discussion. If you like our video, please subscribe our channel. Thank you.